Yeah. Alrighty. Take two.
Take two.
It's fine. Let's make sure we're good. We're newbies at this. It's fine. There we go.
There we
That's
are.
better. Yikes.
A little bit better. Round two.
Thanks to the marketing girls for hanging in there with us. Okay. Make sure everything's muted. Cool. Let's see. Let's see. We have some people popping on. We'll wait a few minutes to get started so more people can join us. Looks like Tiffany's joined. Hey Tiff, how's it going? How's everyone's day going? How's yours?
Good.
Busy?
It was really good. Yeah, it was busy. It
I
was
feel
busy.
like your days are
windy.
mostly busy.
Yeah, it was. Yeah, mostly busy, but good.
Oh, that's good. It was. I don't really care for this weather at all. I prefer if it would just like go straight back
I'm
to
ready.
where it was.
Well, I'm ready for summer, actually. If you really
Straight
need
to
it.
hot.
Well, yeah, actually, yeah, I am.
Whitney's joined us. Hey Whit, how's it going? We'll wait just a few minutes for some more people to join us and then we'll get started. Sound good?
Sounds good.
Cool. We've got Rachel, our commentator, in the background. She's the behind the scenes.
Yeah, she's not gonna come on camera, I have a feeling.
Nope, not coming on camera.
Oh gosh, this makes you want to sit up a little bit straighter
Yeah.
now that you know the whole Facebook world is watching you. So,
I'm not really sure what that means.
the whole, anyone, anywhere.
Just
We have
kidding.
3 viewers.
Just
Look.
kidding.
Oh, Court. Look at that.
Awesome.
Yeah.
Very good.
So do you only treat part-time right now?
I do.
You got
I
that
just
managing
see- yeah,
stuff.
I just see patients in the morning, so
Oh, that's not bad.
No.
That's a good way to start your morning.
it is.
For sure.
7 a.m.
Yeah.
I love it.
Wouldn't have it any other way, I'm sure.
I wouldn't, actually.
All right, well, we'll go ahead and get started. For those of you who are joining us live, thanks for joining in. My name is Regan Ennis, and
My name is Karen Wilson, and I'm a physical therapist. I'm the practice management manager for Advanced and Preferred Physical Therapy.
it's great. We have decided to do some Facebook Live videos just so we can get to know our patient clientele a little bit better, to tell you a little bit about our company, who we are, maybe answer some questions you have along the way. So we'll wait a few more minutes just so people can feed in. I know that there's some of our billing staff who are really hyped up about us coming on. So, hey Jen, how's it going? We sent out our quarterly marketing newsletter today.
That was great. I saw that. Did you get my email back? It was
yeah,
awesome.
it was fun. I
It was
had a lot of
awesome.
fun designing that, but we put in there, we were like, Facebook goes live today, April 3rd. So I'm hoping that we get some of our
I think
staff
we will.
logging in. Ah, Milan, hey, Chloe, look at this. I love it. This is so fun. Chloe.
Good old Chloe.
Yeah. Maybe for some of you who aren't joining us live, you're watching the replay, thanks for joining in with us. If you have any comments along the way, feel free to put them in the comments section below, as we will be checking those periodically and keeping up to date with everything that you bring to our attention. And we definitely want to make sure we're answering all of your questions. So feel free to comment in today during the live video or afterward during the replay, and we'll get back to you for sure. So I think we'll go ahead and get started.
Absolutely.
So again, my name's Regan. I am a marketing coordinator here for Advanced and Preferred Physical Therapy.
And my name is Karen Wilson, and I'm a physical therapist as well as the practice management manager for Advanced and Preferred Physical Therapy.
So today we wanted to let you know that this is our first Facebook Live video, so please bear with us as we kind of figure this out. And if you have any words of encouragement, please place them in the comments below. We will read those and reply to your comments live today. As I mentioned before, if you have any comments afterward and maybe you're watching the replay, place them in the comments and we'll get back to you. So we will do these Facebook Live videos on Tuesdays at 4:15. Or if it's like today and technology is just technology, it may be like 4:20, 4:30. Just bear with us, and we'll get on here eventually on Tuesday afternoons. Today we're going to talk a little bit about advanced and preferred physical therapy. That is why we're here doing what we're doing. And I think it's a really cool opportunity for us to feature not only our therapists, but what we're all about. So I will kind of do an interview with Karen. She's going to tell us a little bit more about the company. So Karen, what can you tell me about who Advanced and Preferred Physical Therapy is?
Well, we're a company that started in April of 2004, and we started as just a couple therapists. What happened was we had no patients. We had to basically learn what we were doing. We didn't know. We knew how to do therapy clearly, but we did not know how to market. And the company has grown to the point that we have 20 clinics. We just opened our 20th clinic yesterday downtown.
Exciting. Go Joe.
In 14 years, less than 14 years. So it's been an awesome road, honestly.
That's awesome. Yeah. How long have you been with APT and PPT?
Since the beginning. So
day
14,
one?
almost 14 years. Yeah.
Wow, that's awesome. That's
Yeah.
great. What can you tell me as far as like advanced and preferred? What's the difference between advanced and preferred?
Sure. So in Kansas City, we have 4 clinics, and they're called Preferred Physical Therapy. We consider them our sister clinics because when the company was started in 2004, we had one clinic in Kansas City, and it was called Advanced, but there was another Advanced in Kansas City. So we changed the name up there in that region to Preferred. So we have 4 clinics in Kansas City called Preferred, 1 in Topeka, and then we have multiple other clinics here in the Wichita area and surrounding areas.
Very cool. So, looks like we have some more people who have joined us. Jesse, Angie, and Sarah, thanks for joining in. We appreciate you taking the time out of your day to do this, and maybe you're just listening along while you're working. So, so
Great.
far we've just addressed who we are as a company, and we are a company of 20 clinics, advanced and preferred, and I think that's great. I think that it's crazy that it's grown so fast, and it's continuing to grow so fast. It's a great opportunity to be a part of this clinic or this company right now. So,
Absolutely.
yeah. So tell me a little bit more about what we do, what our philosophy is.
So with Advanced and Preferred, our philosophy has always really been centered around patient care. So we want to provide the best patient care to our patients and to our customers. We want to be the best physical therapy clinic that we can in this area. And I think the reason that we aspire to do that is because we're focused on the patients.
Definitely.
And really, that's what it's all about. I mean, if you ask any of our staff, and we have amazing staff company-wide, but you ask any of our therapists why they're therapists, it's because they want to help people and they want to help patients. And that's really what drives me as a therapist and what drives all of our staff.
Yeah, and that's definitely who we're looking for in recruiting prospective employees as
Absolutely.
well. So people who just genuinely care, which I think is
Absolutely.
awesome. Across the board, really. In
Yeah.
the billing office,
The front
marketing,
desk staff,
absolutely.
our techs.
Yeah.
I mean, all the way across the board.
It's a common thread.
It is.
Definitely. So, awesome. Looks like we've got quite a few people joining in. That's great. Thanks so much for joining us today. Let's see. Can you tell me a little bit more about maybe our motto, employee satisfaction equals?
Yeah, so we really believe in patient satisfaction. Obviously, that's our number one goal. But what we've learned along the way, for a long time we were focused on patient satisfaction, and what we learned is that if our employees aren't satisfied, our patients are not going to be satisfied. I know that sounds like a really duh, right? But it took us some time to figure that out, and so our employees are our number one. I mean, if we couldn't run the business without our employees, and from the ground up, from the top down, our employees are our biggest asset and who we take care of every day.
Yeah, absolutely. Even outside of the clinic perspective, like you see that day to day. The clinic managers genuinely care about their staff, and I think that's great. Let's see. It looks like we might have some questions. Rach, I may have you fill us in because it looks like they're not coming up on my end. Let's see. So Whitney wants to know, how do I know that APT and PPT is a good fit for me as a patient?
Honestly, well, our philosophy, like I said, is employee satisfaction equals patient satisfaction, but we believe in one-on-one patient care, so we don't double book. We do not see multiple patients at one time. We believe that one-on-one patient care is the way to do it. And
For
we
sure.
we started that from the get-go, and that's really what motivates us as therapists, is to get up and do what we do every day, is that we know that we are going to make a difference in the lives of our patients.
Right. Individual care, I think, is huge, especially in a day and age where there's not as much individuality in healthcare. It
Right.
seems like you wait and wait and wait, and like
Right.
at your doctor's office, and then only to get in and spend 15 minutes with them. And I think
Right.
that that's something that sets PT apart, is you really do have
Yeah,
that.
absolutely.
individual care.
And the difference between physical therapy, occupational therapy, is that we get to spend an enormous amount of time with our patients. And
Yeah.
that is probably one of the most rewarding parts of it. If you ask our therapists, that's one of the things that they would say, is that they get to spend quality time with their patients. And that's why we get up every day, like I said. That's why we do what we do.
Yeah, absolutely.
For that reason.
That's great. I think we'll answer one more question and then maybe move on to some
Okay.
topics. Courtney would like to know, Karen, what do you enjoy most about your job?
My job, well, my job is twofold. I'm a manager, but I also see patients, and honestly, the best part of my job is seeing patients. That's my love, that's my passion, that's what I think I was meant to do, so
Totally.
to speak. So that's what I love the most.
How did you get started in PT?
Wow. Well, I was in undergrad at Pittsburgh State, and I had a friend whose mom was the human resource director at the hospital, and I needed a job for the summer. And I wasn't sure. I thought I wanted to be a teacher and maybe be a therapist, but I wasn't really sure. So she moved me into the PT department for the summer. It was like a huge favor. I didn't ask her to. I said, no, please don't do that. I just need a job to pay my rent. So she moved me into that position, and honestly, I can say that was the moment that I knew. The first week I was there, I knew that it was the job for me.
Oh my gosh, that's crazy.
yeah.
It's really, unique that I think in the PT world, the people who have joined physical therapy, they know that that's their passion.
Right.
Whereas like marketing, I was like, oh, well, I don't know what company I want to join.
Right.
But I'm so glad that I landed in such like an employee-focused, patient-focused company, because it's really been an amazing experience so far. And obviously it has been for you as
Yeah,
well.
absolutely.
So, well, it looks like we have 18 viewers. That's awesome.
That's awesome.
I just wanted to reintroduce ourselves. My name is Regan Ennis, and I am a marketing coordinator for Advanced and Preferred Physical Therapy. And this is Karen.
Yeah, I'm Karen Wilson, and I am the practice management manager for Advanced and Preferred Physical Therapy, and I also manage 3 clinics on the west side of Wichita.
Crazy. That's awesome. So we've talked a little bit about who we are as a company, and if you're catching the replay, you probably you're catching up with us a little bit. Feel free to put your comments below, whether you're watching live or if you have questions during the replay. We'll be checking this video to make sure that we're answering anything that you want to know.
Jen has a question.
Let's see. So Jen says, so physical therapy has seemed intimidating to me. What do you have to offer that can break down that barrier? It's a
Wow.
great question.
It is a great question. Honestly, from our staff, from the front desk, from the first phone call, when we call our patients, we really try to develop a relationship with the patient on the phone. And why do we do that? Some people may ask, but that's really important to us because we want you to know that you're not going to be a number at our clinic, that you're going to be a name, and when you walk in, the front desk is going to remember your name. Obviously, your therapist is going to remember your name, but we want you to be a name and not a number. And that's the first part of that. And then when you meet your therapist, our therapists are amazing. They do amazing jobs every day just taking care of people, and they do a really good job of making our patients feel welcome and warm and comfortable in an environment that isn't always comfortable, because when we're treating someone's low back, we're looking above the low back and below the low back, so we're getting in there, but we always preface it with, this is what I need to do to take a look at you. So we really inform our patients of what's going on.
Right. I think that it's great that there's such there's like a selection there that it's almost like dating. I mean, the front desk is listening to our patients. They're getting to know our patients so that they can put our patients with a therapist that meets their needs. It's not just, you're not just like you said, a number. You really are being put with someone who is truly going to help you get better, which I think is awesome.
So from that first phone call, they ask the story. They ask your story. If you're a patient, they will ask your story and ask what happened and why you're coming to physical therapy. So then the front desk can help to put you with the right physical therapist for you, or occupational therapist, because we do have occupational therapists as well in the company.
Right, definitely. Looks like Kathy's joining us. And Kathy, I just wanted to say thank you for your comment. She said, I've been a
Kathy.
patient at APT several times and I've received the
Hi,
best
Kathy.
treatment.
Yeah,
That's awesome.
She's awesome.
Definitely.
Thanks for joining, Kathy.
Yes. So let's see if we have any more. Jen said, perfect. Thanks so much, Karen. She loves that there's a personal touch with all of this.
Yes.
So thanks for joining in again. Crystal would like to know, could you comment on the different types of therapy you utilize at your clinics? Do you use any new or innovative treatments? So maybe talk about specialties a little bit.
Sure, we have a lot of specialties, multiple specialties at the clinic. At all of our clinics, we see patients. We do dry needling. That's one thing that multiple clinics in Wichita and Kansas City do. We also do pelvic health therapy. We see men's and women's health for patients that have incontinence or pelvic pain, those kinds of things that people don't like to talk about. That's kind of a relatively newer subset of physical therapy. We also do Parkinson's therapy utilizing the LSVT BIG program. That has been a game changer for those patients who have Parkinson's disease and their significant others as well. We have multiple. Is there something I'm missing? I know I'm missing. We do aquatic therapy. We have a lot of things that we do.
That's huge. I actually didn't know aquatic therapy was a thing until I started here at Advanced Physical Therapy, and I know just from my personal life, people in my family who could benefit immensely from that, who maybe are fall risks, but once they're in the pool, they're able to really utilize their therapy to the best of its ability. And having that one-on-one care with your therapist while you're in the pool is awesome too. So that's a great aspect of it, and we offer that in Wichita and KC.
Right.
So
Absolutely.
that's great. And Topeka, I believe, as well. So
Yeah, we do it in Topeka.
yeah,
as well.
that's amazing. So looks like Sarah would like to know, what kind of things can aquatic therapy help with?
Wow. Aquatic therapy can help with a lot of different things. Balance issues, patients that are fall risks, that's a huge thing. We get a lot of our total knee patients. We have to get clearance from their physician, but we get a lot of our total knee patients into the pool as well. That really helps with swelling, it helps with pain immediately post-operatively. We have a handful of physicians that really utilize the pool and like that. We can get pregnant patients in the pool. It really helps with lower back pain. It's a large variety of patients that can get in. Yeah,
right.
I mean, you name it, we can treat it.
We treat that?
Yeah, we treat that. That's we do.
Hashtag. What about, I've heard a lot of people talk about after a surgery they have an incision and they're not supposed to get it wet. So what goes into
So we have a special bandage called Opsite that we put on the incision, and we make sure we put it on. It is a waterproof bandage. Again, we do get clearance from the physician just to make sure, from the orthopedic physician, just to make sure that they're okay with that before we do it. Some physicians will make us wait a couple weeks. Some make us wait a little bit longer to get them in. But
it is possible.
It is well, it's very possible,
Yeah.
and honestly, the research shows that there's no increased risk of infection when we get them in immediately post-op, which is huge.
Right. If they're able to get back in there and start moving.
Right.
Yeah, totally. Angie would like to know more about Alter G. Can you tell us about that?
Yeah, so the Alter G is an anti-gravity treadmill. We have a couple of them, 3 that I can think of company-wide. And what it's basically, NASA helped develop that. It's kind of crazy. It's a treadmill that you step into. You put these, I call them moon pants, but they're shorts that you put on, and you step inside the treadmill, and we zip you in the treadmill. It's got a bag around it, and that bag inflates with air. And what it does is it lifts you up, so it defies gravity. That's kind of what their slogan is, but it is amazing. So patients that have pain, we can get them in there and take their weight off all the way up to, I think, 10 to 15% of body weight, which is, I mean, nothing. You're walking on your big toe. That's it, really. It's kind of crazy, but it makes a huge difference with people that have pain, or if we're trying to get patients on there to basically normalize their gait or get them to walk better.
Right.
It has a camera. We can watch them from the front or the side. That's a really good modality as well.
Really? Yeah,
So.
that's awesome. Meilon would like to know, do you treat children or infants?
Yes.
It's a good question.
It is a good question. We do. We treat all ages, from birth all the way up to geriatrics. I mean, I think our oldest patient just turned 101 at one of our clinics, which is pretty amazing. We had a birthday party for her at the clinic. We did. We really try to take care of our people. So we see kiddos with torticollis. That's where the neck muscle is shortened and they have issues turning their head both directions. We see kiddos that have cerebral palsy, multiple varied diagnoses as well.
Absolutely.
And some of those patients can get in the pool. Some of those patients we see on land. A lot of that is patient education as well, educating the parents. And, you know, some of those kiddos we see long-term. We see them forever and they become part of our family.
Right. Watching them kind of grow up.
Yeah,
Those first few years, they go so fast.
Yeah.
And there's so many changes. So it's important to keep PT at least on the back burner in case you need it for those kiddos. So
Right.
it's awesome. Yeah. Let's see. So, I guess one of my questions is when do I know, or how do I know I need to go to PT? When is the right time to seek PT?
Usually people come to PT when their pain or whatever they're having, if it's pain or they're a fall risk, it starts to invade their personal life.
Right.
So if it impedes your function, then I say you need to do something about it. If you're feeling like, oh, I have a little bit of a shoulder problem, it only causes me problems when I do this or this,
Right.
I would keep an eye on that. You know, you can come in to your physical therapist and talk to your physician as well, and come in and see us, and we can do an evaluation and get you on an exercise program so 2 months down the line you're not in major pain and hurting.
Right. So it can be preventative as well as restorative.
Absolutely.
And so I think one of the cool things that I've seen is people, when we were filming our aquatic video, we had a patient coming in and having aquatic therapy before he had surgery, which I thought was super cool. I didn't even know that was a thing, to be honest. So I think it's great. You learn something new every day, and I think that PT is a huge asset for really anyone.
Right. I mean, if you have any ache or pain, or you have issues going up and down your stairs, or any difficulty like that, we are musculoskeletal experts, and I know that sometimes as physical therapists we have a hard time saying that to people and saying that to our patients, but that's what we're trained to do.
Right.
So we treat patients from the top down and the bottom up. I mean, that's anywhere in between. So
That's fantastic. Yeah. Where can I go get PT with Advanced or Preferred?
we have multiple locations in the Kansas City area. We have 4 locations around. We have 1 in Topeka, and then we have multiple locations in the Wichita and surrounding areas. We've pretty much taken the corner on most in most areas, honestly.
Right.
So you should be able to find an advanced or preferred clinic really close to your home.
Right. And if
Which is
not,
pretty
we
awesome.
need to know.
Yeah.
Right, yeah, let us know. If there's not somewhere where
Right.
you're at that we're not, feel free to leave it in the comments. So if you're just joining us, my name's Regan and this is Karen. We're doing a Facebook Live to talk a little bit more about our company. If you have questions and maybe you're watching the replay, feel free to drop them in the comments below and we will get back to you on all of those. And if I can't answer them, we'll for sure have Karen hop on there and answer those questions for you as well. Looks like we have another question. What is dry needling? That's a good question.
Yeah. Okay,
Yeah.
so dry needling is basically we take needles that, it's not acupuncture, I want to just throw that out there, it's not acupuncture. We do use needles that are similar to an acupuncture needle, and I think that's where it gets confusing, but dry needling works on trigger points, so we insert a small needle into a trigger point and it helps inactivate the trigger point via a cellular process. It's kind of complicated, but I can tell you that it's really, really effective. I myself had some heel pain for years after running a half marathon, and I had some of my therapists treat my calf, not my foot, my calf, for 3 visits, and I have not had that pain since. It's pretty crazy.
So you're a patient yourself.
I'm a patient. As a physical therapist, we're all patients at some time.
There you go.
Because we work on people, so.
That's awesome. I think I watched a video that the Kansas City, one of the news stations there in Kansas City, put on about dry needling, and they had mentioned that with the opioid crisis being as big of a deal as it is, and people really getting addicted to those, there are so many alternatives, and dry needling is a great alternative for pain prescriptions.
It is a great alternative. Muscles can refer pain just like joints can refer pain and nerves can refer pain. So if it's the muscle that's causing the pain, the dry needling is very, very, very effective.
Definitely. Cool. Well, no more questions. So I guess my last question for you, Karen, is why should I choose advanced or preferred physical therapy?
Okay, I have a good answer for you. honestly, I think that we care. I know that we care about our patients. We care about our patients getting better, and we have an enormous amount of specialties company-wide. So that in and of itself is the main reason you should choose advanced or preferred. But the other reason is you'll never be a number at our clinic.
Mm-hmm.
And if you are a number at our clinic, I will give you my personal email and you can let me know, and I will do whatever I can do to change that, because that is not the face that we would ever want to have.
Right.
Um,
Definitely.
so
What a great answer. I love it. Jolene says dry needling sounds like a good alternative. I would have to agree. I am not a needle fan, but
I wasn't either. I mean, I've been to the first course and I can do certain body parts, but I was not a fan either, and I don't like needles. But it's pretty amazing because, you know, my issue is sticking the needle in the vein. We don't do that. We stick it in a muscle. So
A little bit better.
It's a lot better. And to clarify, there's nothing in that needle.
Right.
So there's no medication in the needle. We're not doing a trigger point injection, nothing like that. It is a dry needle. That's why we call it dry needling.
there
So
it
there's
is.
nothing in it.
I never knew where that term came from. That's good. I said that was my last question, but I actually have one more, so I'm sorry. But as far as like coming in to see you, if I'm a returning patient, I know one of the things that we really stress is that therapist doctor, primary care doctor relationship. Can you tell me a little bit more about referrals, or
Absolutely.
if I need a referral, or
Absolutely.
do I not?
Sure. A lot of insurances do not require a referral at this point. Medicare is one of them that does, but a lot of insurances don't require a referral. So we do have limited direct access in the state of Kansas, so you can come and see us. We will still get in contact with your physician. So that's important to us, that we maintain that relationship with your physician, and that is as long as you're okay with that.
Right.
We have rules and regulations that we must follow from the Kansas State Board of Healing Arts, so that we are compliant with everything.
Absolutely.
So
Yeah.
that's, you can go to your physician or you can call me. I can do an evaluation if your insurance allows it without contacting your physician and getting a referral.
Right.
Most of the time. That's not to say always, but
Right.
we definitely will get in contact with your physician as well.
Right. Right.
We
Well, I
wanna-
think that's important to note, just
Yeah.
because it is good to have that contact with your doctor, just to let them know what's kind of going on. And obviously, if you have a concern, going to them first, just to kind of figure it out, and then the referral is
Right.
a good base to start
Right.
out with. But even if your referral isn't for advanced, most of the time you can choose to go to advanced or preferred.
Sure.
So
Absolutely.
be an advocate for yourself, I think, would be a good piece there.
Absolutely.
So-
Yeah, if you don't take care of yourself, you can't take care of anybody else. So that's
Good.
that's
Yes.
super important.
Yes. Well, let's see if we have any more comments. Kaylee says chronic pain management to end the opioid epidemic, and I think that's a huge piece. I think chronic pain is an epidemic in our country, as well as, you know, treating that with harmful pain medications that can be highly addictive. And so physical therapy, can you speak a little bit more about why physical therapy would be a good alternative for that?
Sure. And sometimes physical therapy is used in conjunction with.
Mhm.
So I don't want to say
Knock
we don't
it
ever.
completely
Yeah,
off,
I don't
right.
want to say that we don't ever have patients that are on pain meds. We do, but if you can go to physical therapy and we can put our hands on you and do a really good job of finding the joint or the muscle or the nerve that's causing the problem, why not?
Right.
And we'll give you some exercises to do at home. And honestly, you know, you should have a physical therapist that you go to and you see for the rest of your life.
Absolutely.
Not every day for the rest of your life, not 3 times a week necessarily, but you should have someone that you can call that you consider your physical therapist for life. That's really where our profession is moving, and that's what we believe in as a company.
Definitely. Awesome. Well, I think we're going to call it there. If you're watching the replay, or if you didn't catch a comment or didn't get your question answered, we'll go back and look at those if we missed any. We appreciate you guys coming out and spending your a couple minutes of your afternoon with us. And we will be here on Tuesday afternoons, 4:15, 4:30-ish, if technical difficulties happen, which they do. So we really appreciate you guys. And if you are a patient, we appreciate you making us a part of your family. So,
Yes.
yeah, awesome. Well, have a great afternoon, and we will see you next week.
See you next Tuesday. Thanks.
Bye-bye.